You're watching Talk with Audrey. Welcome back. Over the last 2 decades, the number of Americans with kidney cancer has risen each year, and the most common type of kidney cancer is renal cell carcinoma. It's also called RCC, and it generally affects people between 50 and 70 years of age. But there are some new treatment options available for those affected by advanced RCC, and hopefully this option could help people feel more hopeful. My guests today are Dr. Saby George, who specializes in the treatment of kidney, bladder, and prostate cancers, and he was an investigator on the Opdivo clinical trials, and Dena, president of KCCure, which is funded through grants through Bristol-Myers Squibb. And we're going to talk today about RCC. Welcome.
Thanks,
Thank
Audrey.
you for having us.
Appreciate you both for joining me. Let me start with you, if I can, Dr. George. What is RCC?
RCC, or renal cell carcinoma, is the commonest type of cancer that occur in the kidney. And this is a big problem. It affects nearly 63,000 Americans every year, and it will result in nearly 15,000 patients dying from this cancer. So it's a fatal disease, and we do need to develop a cure for this disease.
What are the signs and symptoms of RCC?
Common signs and symptoms are blood in the urine, flank pain, and the presence of a mass on examination by a doctor. So those are the signs which will lead to investigations like CT scans or ultrasound, which can detect tumor in the kidney. The risk factors for development of RCC include smoking, hypertension, obesity, and exposure to certain type of chemicals. And there are unknown reasons as well, and a small minority of patients develop kidney cancer as a result of familial or genetic disorder.
And so the prognosis, once you've been diagnosed with RCC, what would you say? Is it not so good, or is it treatable at some point?
So early RCC or surgical disease, early disease is curable with surgery potentially. And if it's found out in an advanced stage or stage 4 or locally advanced, which cannot be cured with surgery, then that's not a curable problem. So the newer treatments are being developed in the space of advanced kidney cancer.
Why is kidney cancer on the rise?
We don't know the exact reason why kidney cancer is on the rise, but the causative agents that I identified earlier could be modified, and we could possibly reduce the incidence over the many years in the future if intervened appropriately.
Dena, I understand your husband passed from RCC, and that's why you created KCCure. Tell us about your organization.
So KCCure is a grassroots organization of patients and doctors that have come together to increase research funding and raise awareness and education about the disease.
Wow, so what was life like for him?
You know, I think one of the most difficult issues that we had was finding information about treatment options that were available to us. I think that's why it's been so important to us as an organization to ensure that educational materials are available. We're grateful to industry partners like BMS who have helped us produce some of that material so patients can know what treatment options are available for them.
So Dr. George, Dena's husband was relatively young, but I thought that this disease occurs more often in people from age 50 to 70. Did he have some kind of predisposition or family history?
I don't know the specific. I'll let Dena talk about it.
Yeah, you know, for Chris, we suspect that there was some genetic component to his disease. His paternal grandfather died of kidney cancer. He was diagnosed at a young age, which might be indicative of some type of genetic component. Unfortunately, we really don't have the research to know what caused it. It's one of the reasons that this type of advocacy and research that I'm working on is so important. I have 2 daughters, they're 9 and 13, and I worry about whether they're at risk for this disease. Making sure that we find a cure is very important to me.
Absolutely. Well, doctor, I understand that there are some new treatment options available that look promising.
That is true, and the newest treatment option approved by FDA for advanced kidney cancer is a combination of immunotherapy drugs named Opdivo and Yervoy. I was a clinical investigator on that trial, and I'm a paid consultant of BMS and other pharmaceutical companies. That being said, this combination can activate the body's immune system and the immune cells like T cells go and fight the cancer cells. And this study demonstrated that the combination can shrink tumor in more patients and also make the patients who receive the combination live longer compared to the standard comparator on that trial named sunitinib. And that's the reason why FDA approved this. And also, interestingly, this combination also was able to put 9% of patients in complete remission, which is really getting close to cure.
Well, it does sound promising. So if someone is being treated for RCC, what should they say to their doctor in order to get the ball rolling to find out whether or not this new treatment option would be helpful to them?
Right. Most of the doctors know about this, but again, this treatment option is available for patients who were not treated before, meaning treatment naive patients, and also patients who belong to what's called intermediate and poor risk group. So there's a lot of data out there to educate both the patients as well as the doctors, and there are various websites, including Dena's KCCure website, Kidney Cancer Association, Optivo.com, and NCI, and our cancer center, Roswell Park Cancer Institute. All these centers have a lot of resources which can basically educate the patients as well as the doctors.
All right, so I think everyone, it's really important. Again, I always say, informs empowered. So if you don't know about something, then you can't ask about it. So check with your doctor. Thanks so much, Dr. George and Dena Battle, for joining me on the show today. And Dena, give me your website address one more time, if you would, please.
Sure. It's kccure.org.
And what other kinds of information can people find on the site?
People can find information about the latest treatments that are available, and they can also find ways to connect and communicate with other patients who are diagnosed with RCC.
Wonderful. I thank you again, Dena, for sharing your husband's story and for the work that you're doing in order to help find a cure. And Dr. George, for all of this great information about new possibilities in treatment.
Thank you very much.
Thank you.